Hello, I'm Desiree Robles, and today I will be presenting my management requirements for the prevention of laminitis. So today we will be going over the introduction and background to my horse and I, the research slides regarding what laminitis is, the early signs and symptoms, and preventative measures for high-risk horses, the specific considerations, nutritional guidelines for laminitis, additional recommendations, management guidelines for laminitis, and I'll leave you all off with the key takeaways. So a really quick introduction. I'm an experienced horse trainer, handler, and rider. I obtained my Bachelor's of Art in Psychology from Whittier College. I obtained my Master's of Science in Animal Care and Behavior from Unity College, and I'm certified in equine assisted therapy. And for my course project, I use the horse that I'm currently working and training with. His name is Handsome. He's an 18-year-old red roan quarter horse. He is about 1,350 pounds, about 15.2 hands high. He is insulin resistant and he is at a high risk for laminitis. So what is laminitis? Laminitis is the inflation of the lamine, which is the soft tissue structures that attach the coffin or pedal bone of the foot to the hoof wall. So this failure of those tissues to really bond to the hoof wall and to the pedal bone in the hoof really results in that bone rotating and sinking within the hoof. And this inflammation and damage to the mane causes extreme pain, instability of the coffin bone in the hoof, and lameness in horses, which is really why it's important and crucial to be able to understand the early signs and symptoms in order to diagnose laminitis and prevent laminitis early on. So the early signs and symptoms that you really want to look out for is a strong digital pulse, hot hooves, distorted hoof shapes or unusual rings, also known as founder's rings, increased heart rate, too much or too little foot lifting, stretch or bleeding lamine, a shortened stride, increased insulin levels, obesity, or anything along the lines of diarrhea, infection, or an inflammatory response. So really, we just want to make sure that our horses are always in the most optimum health. But any of these early signs is definitely need to call a vet. in order to have your horse diagnosed and properly looked at. And preventative measures are always better than a diagnosis and prescription. So really staying on top of the early signs and symptoms is crucial. So the three preventative measures for high-risk horses really boil down to three different categories. One is a strict diet with proper access to forage. The second is proper husbandry care and routine veterinary and farrier care. And the last is proper exercise regimen for your horse and proper maintenance levels. So we're going to break these down further and really dive deeper into these three categories. So the special considerations to keep in mind while caring for any horse, but especially a horse at high risk or diagnosed with laminitis, includes the additional burdens such as the invested time, physical management, husbandry, and financial burdens that are ensued when you take on the responsibilities of caring for an equine partner. So really we want to ensure that you are aware of the routine veterinary care and annual blood drawings. These annual blood drawings are crucial, especially for horses at high risk for laminitis, due to the fact that blood drawings can determine the blood sugar levels in the horses, which can be indicators for laminitis, EMS, as well as insulin resistance. So these are crucial to get done. A dentist will also need to come check their teeth once a year for optimal oral health. That's just to ensure that they have the proper oral health. There's no maladaptive behavior such as cribbing that can then affect their diet. A farrier will also need to come out every 6 to 8 weeks for proper hoof care. This is crucial for horses with laminitis due to the fact that they are already very sensitive on their hooves and they need to have the proper hoof care. And of course, yearly vaccinations conducted by a vet for all of our horses to ensure the most optimum health. So the nutritional guidelines for horses with laminitis really boils down to cutting excessive sugars that can cause laminitic episodes. So you really want to refrain from grain feeds or any sweet feeds such as oats, barley, corn, any feed that has a high non-structural carbohydrate really needs to be cut from the diets of obese horses, insulin-resistant horses, horses with laminitis, etc. So you really want to focus on feeding grass hay as well as mature hay for obese horses and insulin-resistant horses due to their lower digestible energy and NSC content. So NSC is a non-structural carbohydrate. So you really want to shoot for the non-structural carbohydrate content of about less than 10%. That's the recommendation for horses with laminitis. And you really want to focus on avoiding overfeeding and really focus on the proper BTW and BCS for proper maintenance levels to ensure that they're also working off the glucose in their blood for their proper weight and maintenance levels. And when I had first met Handsome, his owner had actually thought like, okay, I'm going to refrain from oats, barley, corn, and she was feeding him nothing but alfalfa. And that I had to explain was also an issue due to the fact that alfalfa has about a 20-point count of non-structural carbohydrate when we really were trying to shoot for less than 10%, and she was feeding about 20, and anything over about 16% is like off the wall for a horse with laminitis. So she was still wondering why he was having his laminitic episodes, but I had to explain to her the nutritional guidelines for a horse with laminitis. So additional recommendations, and these recommendations came from a study conducted by Gore. So down at the bottom, and in my references, you can see the article in which I reference Gore. But he is a phenomenal author when it comes to equine management, especially for laminitic horses. So definitely is an interesting read. But he really stressed restricting pasture time to about 1 to 2 hours max, or denying access altogether for horses who had just recently had laminitic episodes or an insane high risk for laminitis. And that may seem odd or cruel to any horse owner, but really understanding the amount of sugars that a horse can intake while foraging throughout the day, specifically due to um, the photosynthesis and how that happens in the grass, and at what point of the day your horse is obtaining the most sugars, versus how long they are out foraging out in the pastures. So understanding that those two go hand in hand in the sugar levels of your horse is crucial. But he also talked about the horses that are at a high maintenance level and are high working horses, that are insulin resistant but not obese. So these working horses, in order to kind of manage their diet when they aren't obese and they are more on the lean side, they're working at a high maintenance level. Adding corn, soy oils, or stabilized rice bran, or beet soaked beet pulp can also be added for more digestible energy. And this can kind of, the way I like to think about it is, it isn't something that should be given every day as part of their diet, but it is something to kind of help balance the amount of glucose that they're working off, and making sure that their blood sugar levels stay at the proper levels, just like a diabetic who, shouldn't consume sugars due to their blood sugar levels and their inability to break down glucose. But if their blood sugar levels drop too suddenly, too soon, it's also an issue where, you do need to drink a little milk carton or something along that nature, just to give you a little bit of sugar, due to the quick drop in glucose. So this is really tailored for the high maintenance level working horse. But I wanted to add that because there are horses who are insulin resistant but not obese and are at a higher maintenance level who could require and benefit from this in their diet. And the overall management guidelines for laminitis would be to target weight loss for obese horses. So really we're looking at trying to drop 1% of their initial body weight per week over the course of 3 to 4 months. So really this is just, with regular turnout and exercise, we want to try to increase the insulin sensitivity for glucose. So with any exercise, you're going to see that the insulin sensitivity for glucose kicks in for about 24 to 48 hours and helps lower high blood sugar levels. So we really want to get these horses active as much as possible, in an appropriate manner. So the Gore also spoke about The perfect sweet spot that he had found for an exercise regimen for horses with laminitis was about 2 to 3 sessions per week for about 20 to 30-minute turnouts, while gradually increasing the intensity and duration until you achieved your target weight loss for your horse. And this is just to keep those insulin sensitivity levels and those high blood sugar levels low and controlled. So really the key takeaways that I would love to leave you all with today are the risk factors for laminitis, obesity, insulin resistance, and EMS can all be mitigated by a very strict diet and non-structural carbohydrate content of less than 10%, a change in exercise regimen, which is really going to help the glucose sensitivity and it's going to help keep those blood sugar levels low, and also to be able to manage symptoms and laminitis in order to prevent illnesses. So we really want to keep an eye out for any of those early signs and symptoms in order to prevent any of these illnesses or any illness in general within our horse and keep them in their most optimum state of health.